Hey, future medics, it's me, Tina, your medic mentor. Today we're talking about the most important antiarrhythmic you're going to use in EMS. It's amiodarone. And the brand name is cortisone, but you'll hear us call it amiodarone. This one is a sodium channel blocker, and it's also a class 3 antiarrhythmic. Now, this one works by prolonging action potential and the refractory period in the heart. Translation: it slows electrical activity that tends to cause some dysrhythmias, especially ventricular ones. Now, we're going to use these in two situations. You're going to use it in stable wide, so that QRS is wide, wide complex tachycardias, so stable VTach with a pulse, okay? And VTach without a pulse, that's in cardiac arrest. VTach and VFib, we're going to use this. We're going to try defibrillating. If that doesn't work, we're going to switch to amiodarone and epi. This one has two different doses, but it's not as bad as the last ones we saw. So we're going to take it. It depends how you're treating, like what you're treating. So let's take it one by one. Let's start with cardiac arrest. So in cardiac arrest, you're going to either have ventricular tachycardia or ventricular fibrillation, no pulse, okay? So you'll do CPR, you'll do your defibrillation, and you'll do 300 milligrams of amiodarone, IV or IO. Just push it in, slam it in there. It's fine, okay? Take your time, run through your algorithm. If nothing has changed, we're going to give one more dose, but it's half. Your second dose is 150 milligrams, IV or IO, flush it in. And that's it for your cardiac arrest. Now, for your stable VTach, where a person is awake and talking to you, has a pulse, we're going to make an infusion. It's going to drip in over time. So we're going to do 150 milligrams of amiodarone in 100 milliliters of either normal saline or D5W. And that's going to drip in over 10 minutes. So it just depends what we're dealing with. Cardiac arrest, you've got 2. And stable VTach, we've got a drip that we're going to drip in over time. Okay, you've got that. You're fine. Let's talk about some side effects though. This is a sodium channel blocker. Sodium is important for muscle contractions. So we're probably not going to have as much, which can cause bradycardia, which can cause hypotension, okay? Which can cause some heart blocks sometimes, but it also can cause prolonged QT, which can lead to other dysrhythmias. So keep a really close eye on this patient. Obviously, you're going to have a 12 lead because you identified VTach. Keep it on them and keep monitoring it, okay? So for contraindications, hypotension, bradycardia, but also those high degree heart blocks. So second and third degree heart block, Here's your takeaway. Amiodarone is your go-to for life-threatening ventricular dysrhythmias. But it does have some side effects and some drawbacks. So it needs to be given specifically, it needs to be monitored closely, and you need to follow up every administration with reassessment of your patient. That's it. You're doing a great job. We're at the end of these drug cards now. There's only a few left, and you've gotten through them. So I'll see you for the next one.